the slides?
Yes, sir.
Okay, thank you. So veterinary public health. When we talk about veterinary public health, we have to talk about the deep concerns that veterinary public health used to have. Okay, so whenever we talk about health, thing is that you have to know hygiene. So hygiene, she was nothing but the daughter of Chiron. He was in a Greek mythology. Then this lady Hygia, basically she was nothing but the she was the goddess. She was the personification for health, cleanliness, and hygiene. Okay, and that is why from this word Hygia came the word hygiene. So according to the World Health Organization, hygiene, these are nothing but the conditions as well as the practices which helps to maintain your health, and it helps in prevention of the spread of the diseases. That is nothing but hygiene. Okay, it is a condition. So this is hygiene is a condition and the practices to maintain health as well as to prevent the spread of diseases. This is the definition by the World Health Organization. In examination, you write your own definition, I'll be giving you a mark 0. So I want this particular definition. Okay? And remember, hygiene is nothing but a condition as well as the practices which is maintaining your health as well as preventing the spread of the diseases. That is very much in line with today's world. What is happening in COVID? You are maintaining your health as well as you are cleaning your hands, you're washing your hands, you're cleaning yourself, you're wearing the face mask. That is nothing but to prevent the spread of the diseases. Okay. Number two, whenever we talk about veterinary public health, the number two thing is your health. So what is happening is that in ancient times, if physically you are okay, if mentally you are okay, and if you were a complete, if there was no disease in you, then people used to consider that okay, this person is healthy enough. But right now in 21st century or say in the 20th century, when we talk about health, it's about your physical as well as social as well as mental well-being, and not only the absence of disease. For example, a person may be a very physically, he must be a very physically fit, he may not be having any diseases, but mentally, if he is unfit, then he is not healthy enough. You have seen many suicide cases that is happening in India. That is because they are not fit. In USA, you must have heard many of the people, there is shooting going on, right? Because socially they are outcast. There are people who are not trying to make friends with them and they are ignoring them. And that is why they feel like they are socially outcast. And that is why many of the gunnings in schools, they are gunning. I mean, they are shooting down the people. So that also is a part of health now. Then physical. Some guys maybe, they may not be healthy enough. I mean, they may not be, their physique may not be very good enough. So physical, if that is like some people, they don't have enough food to eat, just because they are not having any diseases, does not mean that they are healthy enough. For example, people who are dying because of starvation, mentally and socially, they may be okay, they are still fine, but because of starvation, physically they may not be fit. So, health is nothing but physical, mental, and social well being, and not merely absence of disease. So, try to remember this. Then comes to veterinary public health. The veterinary public health is nothing but the sum of all contribution to physical, mental, social well-being of humans through an understanding and application of veterinary science. This is the definition of VPH, and this definition was given in the year 1999 in Teramo, Italy. Okay, so that is nothing but it is the sum of all contribution to the physical as well as mental and social well-being of humans through an understanding and application of veterinary science. I'll come about what are the understanding and what are the application of the veterinary science. So, my dear friends, these are the three definitions or the three terms that are again and again synonymously coming. What do you mean by hygiene? What do you mean by health? What do you mean by veterinary public health? These things should be written as it is because this is a definition. This is a definition which is given by World Health Organization, and I would ask you to mug it up for the time being. And after the after your third year is over, after your fourth year, fifth year, if you don't remember, I don't blame you. I will not have any grudge against you. During this time in third year, if you're not able to answer this type of questions, I'll be having a grudge against you. Okay. Now, being a public health, there are some things. Okay. One of the things is that, yeah, in the promotion of animal health. Okay. If the health of the animal is good, then of course the production, the productivity of the animal will be also good. For example, nowadays you're hearing a lot of terms like farm to fork, farm to or ready to eat, right? Farm to fork. The thing is that in the farm itself, if the animal health is in the best of its is in the pink of its life, okay, it is in the best of its condition. Definitely, the productivity or what if you're using the farm animals, say the cattle is used for the milk purpose, definitely the production of milk will be better, and the quality of the milk also will be better. Right. Now, suppose the farm, the animal's condition is very, very hopeless. I mean, it's very unimaginably, just imagine that it's very, the animals are suffering from very bad conditions. Definitely, milk product and the quality of milk will not be good. So that is nothing but your number one. We are trying to promote the animal health so that we can improve the production as well as the productivity. Okay. Number two is that we are trying to protect the foodstuff of animal origin for human consumption so that we can guarantee their safety as well as their nutritional quality and prevent the spread of the disease. For example, now you are rearing pig, the pigs are in you are rearing pig and you are maintaining all the HACCP, which definitely I'll come afterwards. You are maintaining all the health conditions in such a way that the animal is very healthy. So what happens is that when the animal is healthy, when you're slaughtering the animal for the meat purpose, the meat also will be in a very good quality one. So what happened? Suppose the animals again. Example is that there is a E. coli outbreak in the animals, and you are culling the animals, such type of animals. The meat will be contaminated with E. coli, which in turn can affect you when you eat the meat. Right? It may not only be pigs. It may not only be pork. It may be chicken. It can be chicken, or it can be mutton, etc. So in the farm level, if the animal conditions are being protected, if they are being reared properly, then later on, whatever way we are rearing them, maybe for the milk purpose or the meat purpose, their quality will be better. It will be good for consumption, and thereby we can prevent the spread of the disease. Then number three is that in public health, especially veterinary public health, we go for the surveillance and we go for the prevention and control of zoonotic diseases. Okay, generally we are going for the morbidity, mortality, disability of the diseases suffered by the animals. So here I mean to say is that we are talking about the epidemiology part of the public health, right? And in the previous slide, we were talking about the milk and meat quality, that means the food quality of the animals that can help in in the betterment of its quality as well as prevent the spread of disease. Number four is that it will help in the environmental protection. So this number 3 point is not only about epidemiology, it is also about zoonotic diseases. So zoonotic diseases means those type of diseases which can spread from man to animal or animal to man naturally. Okay, the word naturally is very, very important. For example, anthrax. Anthrax can spread from man to animal, I mean from animal to man, right? And it can spread through the spores, that means through inhalation, right? But what happened is that, so that is a natural process. But the guys, the terrorists, they are using it for spreading the terror by using the spores, and you know what happened in the USA and all. So they are using it for bioterrorism, right? So what I mean to say is that when there is a spread of a disease, it may be from man to animal or animal to man, and the spread of a disease is natural. It may be through your taking of breath, or through the saliva, or if there is a cut in your hand, and through the sweat, etc., where there is no intention but it happened naturally. So those are the things that we mean by zoonosis. Okay. Number 4 point is that we are talking environmental protection, environmental safety, environmental zoonotic diseases. These are very important. So much so that the Supreme Court had given an order that a course of environment should be taught in every colleges. There should be a course about environment and its protection, its safety, and laws, etc. It was given by that's why environmental factors or about the environmental safety and everything is being given by say our this thing. So this part is coming in veterinary public health. So we are talking about the environmental hygiene. Now, there are times that we have to take certain steps so that we can ensure veterinary public health, because we are talking not only we're talking about the zoonotic disease, veterinary public health, of the environment. Actually, we are talking about the whole veterinary as well as animal health. Okay. So how we ensure that it will help in the betterment of the better production, which the betterment of the human population's health, etc. So there are certain steps that we have to take so that we can ensure that the public health would be a better place. Okay. For example, uh, so why veterinary public health is so important is that if you go into the World Health Organization, there is no such subject called medicine, surgery, etc. There is only a subject called veterinary public health. I mean public health. Okay. In that public health, all the other courses are entering. So right now, the safety of human is one of our priority. But not only the safety of human, it is also the safety of the animals that is very important right now. Okay. Earlier, people think that okay, if humans are okay, we are no need to worry. But now there is a role reversal. We come to know that if the humans or the human population has to be safe, then the population around us of the animals, of the birds, they have to be also safe. That is the only way that we also can be safe. Okay, so therefore we have to take certain steps in such kind of conditions. Number one is your diagnosis, communications, as well as surveillance and eradication of animals, diseases, as well as zoonosis. So, COVID-19. When COVID-19 first happened, we could not diagnose in the very beginning of the outbreak. We could not diagnose that which what type of virus is this that is causing the disease, right? So diagnosis was very important. We know that animals are human beings are being affected by COVID-19, but at first we never knew that there was a COVID-19. We know that there was a disease that is happening. So that diagnosis has to be done. Then you have to communicate. Now, once the diagnosis, once the COVID-19 was diagnosed that yes, this is SARS, this is a coronavirus, and under the coronavirus, this is the particular disease that is causing. That means we gave a name to that coronavirus, COVID-19, right? Then we started communicating to the other world. Like these are the countries that has been suffering from COVID-19. Okay. Then we are doing the surveillance. Surveillance, nothing but the what to say, the extended part of the monitoring. Then we go for the eradication of the animal diseases and zoonosis. So right now we are in the surveillance part, but not in the eradication part. Okay. Number two is the control safety of foodstuffs of animal origin throughout the production chain. When we'll be giving the examples of how milk production is being done, then you will be understanding that where we have to take precautions. Okay, for example, when we are milking the animals, okay, the thing is that the person who is milking, he should be in a healthy condition. Number two is that the cow should also will be in the uh, what to say, in a very healthy conditions. Then you have to take care about the teats from where you're milking, right? So those are the safety chains that you have to remember. Then control of products and waste products of animal origin. So control of products means you are making milk. From the milk, you are making many different type of byproducts, say rasgulla, chhanni, kheer, dahi, etc. Animal origin, maybe the bones, you're not using the horns, you're not using, but you are utilizing it. Sometimes they are making bone meal out of it, out of the bones. From the horns, or say from the bones, they are making different type of, say, pins, etc., or say your buttons, or some jewelries they used to make in olden times. Now also people are still making it. Okay, so those type we are trying to use it, those things. And whenever you are making those type of products or waste material you are making, you have to take extra precautions. Then control of zoo technical hygiene. That means whatever the hygiene whatever the farm practices you're doing, you're taking the hygiene part into it. For example, control of animal feeds. Whenever you're making the animal feeds, you have to ensure that the top qualities or all the quality control has to be taken care of it. The persons who are making, they should be healthy. If they are suffering from, say, cold or influenza, and if they are not taking enough care, like they are spitting here and there, that may affect the animal feeds, which may cause disease to the animal and indirectly to the human beings. Control the veterinary drugs. I think you are studying in the the pharmacology. So there are certain drugs. Almost all the drugs, they are having residues effects. Okay. So what happens is that when you inject the animal, then they do have a withdrawal period. For a withdrawal period means that from the animal, the drugs should be completely eradicated, or it should be completely eliminated. But sometimes what the owner do is that instead of completely eliminated, before the duration that the drugs is completely eliminated from the system of the animal, they used to slaughter it, or they used to milk the animals. As a result of which, the residues of such veterinary drugs will be there in that products, which we are, and hence this is how we are getting the microbial resistance. This is how the antimicrobial resistance is happening. Then the control of wild fauna and their environment. So this is what is very important right now, or for the last 10, 20 years, this is what we are trying to control it. For example, the rise of COVID-19 again. This happened because, uh, or have you ever heard about SARS, guys? When did the SARS outbreak occur? Or first and second year of the century? Okay, fine. So, do you know that how did the SARS spread to human beings? Okay, that's very good. And what is your name? Kim Agarwal. Okay, that's good. Like it. So I like those guys who really have this kind of informations. It's not only about your books that you should know about your surroundings. Okay, what him Agarwal has said is very good. Thing is that the bats were the main culprit, but in between bats, okay, let me just write here. So from bats, it entered to civet cats, okay, and through civet cats to man. And what happened is that bats were the reservoir or they were the origin of this SARS virus. Okay, but when the civet cats interacted with these bats, so these civet cats, what happened was that they were the one in which this virus, the SARS virus, was multiplying. Or okay, and what happened was that this man was eating these civet cats not only for the meat but uh, for their skin that was used for the leather purpose, most probably. And that was the reason why SARS was spreading into the human population. So now also COVID-19, we know that the SARS virus, the coronavirus was present in bats, and we know that it has spread to man. But right now we are having a problem. We are having a problem with the middle animal, like the mixing vessel in which the coronavirus was multiplying. Okay, so this control of wild fauna in the environment is very important because what is happening is that we are having a problem of this called spillover. Okay, spillover nothing. It means that the diseases of the wild animals is spreading into the human beings. That is nothing but your spillover. For example, Ebola. I hope you have heard about Ebola. Okay, it has in Africa. It is spreading like hell, and it is a BSL-4 organisms. BSL-4 means there is no vaccine against it. So SARS, is it what type of organism is it? BSL-1, BSL-2, BSL-3, BSL-4? Just a wild guess. Give me a wild guess. Anyone? Give me a. You are. Hey guys, come on, yeah. Give me a guess. It's coming under category one, two, three, or four. Which one? It's okay. It's your today's first class. I understand. Huh?
Four.
Four. Okay. Anyone else? Give me a guess. Yeah, it's three. One BSL-1 means biosafety. This one biosafety level one means organisms. The person who's handling organisms which does not cause any type of disease to human beings. BSL-2 means the organism may cause a little bit of disease, but it is not very harmful. I mean, you will not die. BSL-3 means organisms which will cause death, but you are having vaccines for it. Okay, so COVID-19, we are having vaccines for it. So that is why it is coming under category 3. But when there was a outbreak of COVID in the very beginning, it was under COVID, BSL-4 because for BSL-4, this type of organisms, we don't have any vaccines and it caused a lot of death. Okay. And the last is your control of international trade in animals, animal products, animal waste, and animal origin. Uh, you can very well guess about it. What type of trades is going on? Basically, half of the trades that we are going that is going on in the world is all under a microscope, or say it's all illegal. Okay. Now coming about your role and position of the official veterinary services. So role and position of official veterinary services is the most important part to work. Okay. So a veterinary services basically it will guarantee. has to give a guarantee about the achievement of the health objectives set by the country as well as fairness in trade. So every country it's having their own health objectives. They may be saying that okay, in our country we are our animals are so they are completely free of enterprise. So this guarantee has to be given by the veterinary services. And in fairness of trade means that whatever the cow or whatever the animal is costing here in Mizoram, it should be the same costing there in the other parts of the country. Basically, it doesn't happen. But this is what we are trying to say that yes, this is how it should happen. Okay. Number two is that about the animal health, and we are talking about the safety, about the policy, certification, and whenever we are trading, this thing has to come. Whatever this thing is coming, it has to come again by the veterinary services. It has to be guaranteed by the veterinary services. So this is what I'm talking about in general. So veterinary public health means we are going into the zoonosis, epidemiology. We are going for the food protection. That means it may be about food microbiology, meat hygiene, milk hygiene, food chemistry, etc. Then we are going for the VPH services, that is farm to table, farm to fork, and we are talking about the environmental health issues. Okay. So the core domains, there are a lot of core domains. This is just for your knowledge. For example, diagnosis, surveillance, and the epidemiology part. Then we are talking about the food protection. Then we are talking about the management of the health aspects of laboratory animal facilities. Then we are going for the biomedical research. Then we are giving the health education as well as the extension, production and control of the biological weapons, management of the wild as well as the domestic animal population. We are giving the best quality of drinking water in the environment, then the management of the public health emergencies. So, in short, the whatever the core domain of the veterinary public health is that it is the combination of animal health and veterinary health, animal husbandry as well as the veterinary science. So we are the one which are handling each and everything. Okay. Here, animal husbandry is also coming inside the domain of the VPH, as well as the veterinary science also is coming under the VPH. Scope of VPH, the scope of VPH is very tremendous, so to say. But in our country, I'm very sad to say that okay, the scope is not that high because people don't understand the uh, exact meaning of the veterinary public health. Basically, what public health is nothing but it's a multidiscipline subject. Because here, not only the veterinarians uh, in the government or the non-government posts, but even the private sectors, they are also being affected. Okay, for example, we are saying One Health. So, a very good example of One Health is that there is a spread of COVID-19. It is not only affecting the veterinarians as well as the medicals or the nurses. It is affecting people of all aspects of life. They may be farmers, they may be poor, they may be engineers, they may be of general line, they may be of non-general line, etc. Right? So this is where the public health is coming up. So it is why I'm trying to say that it is multidisciplinary subject. So professions like physicians, like nurses, like sanitarians, environmental specialists, paraveterinary staffs, auxiliaries, they all can contribute in the treatment as well as control and the prevention of the disease of origin. I don't know about your state, but in our state, for example, here, our local level task force. So, local level task force, they are of different background. Some people are NGOs, some people are social workers, some are medical officers, some are of engineer background, and these are the guys who are doing their job and they are helping in the prevention of the diseases. Okay, so in one way public health does not mean that it should be only about the veterinarians. It is also about the others and how they can help us in the spread of the diseases. Okay. Then there are certain changes which are having an immediate scope under the VPH. For example, the farming methods. This is one of the very vague topic that we have to but these are the topics that we have to understand. For example, the farming methods. Earlier, people used to add a lot of chemicals in their farms so that they can have a proper growth. So that the production of the farms will increase and they will have a nice life, right? But what is happening is that chemicals which they were adding, it was basically killing the soils. So now we are coming into modern era of this one organic farming, where we are not adding any chemicals, but we are adding the what to say manures, right? So Sikkim is one of the first state that is completely organic, right? So this is nothing but the changes of the farms. So likewise, also intensity of livestock production also is being changed. For example, now what to say is that. People are rearing organic meat. What they are doing is that they are just letting it go into and they are having a big farm. They are just letting it go and they will eat their own food and they will come back, right? So that is nothing but organic farming. But if in Delhi when I went in 2018 and 2019, the organic meat of chicken normally, what is the price of 1 kg of chicken in your place outside Mizoram? Guys, please respond. I have to go for another eight more slides, and if you're not responding, I'll not be able to finish the class. So, what is the
260.
260 rupees? Okay, that is live bird or culled bird?
Sir, not live.
Not live. Okay. So imagine that is not a non that will be non-organic one, right? So organic, in Delhi in 2019, 1 kg was 800 rupees. So just imagine how much the farmer is making up. So these are one of the farming methods. Not only the organic farming, we are talking about the aquaculture. We are also talking about the bioponics, aquaponics, etc. And also we are going for the genetically modified organisms or genetic engineering. Also we are doing. Okay. Then these are the things that is coming under the farm methods. Then we are also using the antimicrobial agents, which may help in the promotion against certain diseases, or it may act as a prophylaxis. Then waste disposal. Earlier, they will just dump it into the sea, or dump it into the river, or dump it into the pond. Now we are not doing it at all. We have to first treat the waste disposal, and then only we can dump it. Then we are trying to increase the marginal holdings as well as rural property up. So what our honorable prime minister is saying that by 2030, he wants to 2030 or 2022, he wants to double the farmers' income. So this is how the doubling of the farmers' income is going to happen. Then ruralization of the urban people, of the urban areas, so that because what is happening is that people are moving to the cities. So we are trying to revert it back so that the urban people will come back and they will help us in animal production as well as farming. Okay. Then comes your food production chain. So food production chain, I'll be describing about in detail about HACCP, but just so that I'm just sensitizing you what is HACCP. HACCP is nothing but hazard analysis critical control point. And this is one of the most stringent measures these guys used to take so that it will help in the it will help the food from farm to fork. Whatever we are doing, it is because of this HACCP only. Okay, this in the subsequent classes I'll be coming. So please remember, HACCP means hazard analysis critical control points, and all of these are having different definitions of their own. I'll be explaining in the subsequent classes. Then trade, travel, and movement. Basically, trade, travel, and movement. All these things happens because of the international trade unions is happening, where like World Trade Organization is happening, and we are supposed to use about the sanitary as well as the phytosanitary methods. That means These are the things which will be explained in the subsequent classes thoroughly. I'm just trying to sensitize you. What are the things that is coming in this type of classes? And of course, interaction between the humans and animals, yeah, it is happening a lot. Animal-related diseases, for example, because of the tourism. What are the hazards are happening? Then what are the roles of the companion animals and how it can affect the human beings? That is what we are talking about, the zoonotic diseases. Then biomedical applications like xenotransplantations. Then disasters which may be of natural or man-made. For example, a lot of thunder, like what to say that in Bay of Bengal, a lot of this thing depression is happening. A lot of what to say hurricanes as well as things are happening. This may be because of natural. It may be of natural intention. And if you see in Himachal Pradesh, a lot of landslides are happening. It may be because of the man-made disasters because he is deforesting, cutting off trees too much. And emerging and re-emerging of the diseases. Many of the diseases, for example, this one, avian influenza, they say that it was in 1920 or in 1919 it happened, and then suddenly it was completely vanished. Then suddenly it is coming back in uh, 2000 something. There was a bird flu or bird influenza in our country, most probably in Maharashtra. So this there may be a certain conditions which may prevent the diseases from emerging, but when certain conditions are being met for the particular disease to thrive, then they emerges. So this thing also will be thoroughly explained in the zoonotic classes. Then your reduced resources. Reduced resources, there are what is happening is that people are not giving enough fund towards the VPH, and there are many people who have a very poor perception and they don't understand what exactly VPH is all about. And that is the reason why in our country the VPH is not given a very high uh, importance. But countries like USA, developed countries, wherever you go, uh, public health that is being given the utmost importance. Then the pace of change, uh, you know, uh, because of the advance of the internet, somebody, if you're, please off your this thing, you're disturbing me. So, pace of change means there are certain, because of the internet, or people have to change with time. Okay, we cannot just because a person was born in 1970s or say in the 1980s, he cannot compare his childhood with today's world, right? Today's childhood, right? Those days there may not be computer, but he or she has to know about the computer, and he has to go at pace with whatever is happening at today's world. So that is nothing about the pace of change, right? Then flexibility as well as innovation also is being required. Then last, it's not that VPH is very wide and varied, and a lot of things are there. There may be a lot of difference in the nature of VPH. Some may like to work in the environmental sector, some may like to work in the, but then it all comes into the VPH. Then the organization sector, especially in our country, it's very disarray. Okay, and this is the reason why we are having a lot of problem. And these difficulties, if these differences can be made, if we can completely come overcome it, then it can really help us. In just in case of COVID-19 also, especially in Mizoram, it is the veterinarians who had gone and established the lab. And there are certain labs in Assam also which was established by veterinarians. But then all the credit has been taken by the medical officers. It's not that we are also wanting the credit, but this is what small examples of it. So there will be always a differences, and we should try to overcome those differences. Okay. So We need a strong vertical communications between the different layers of the government or the non-government or the private sectors, so that this type of differences we can overcome. And thank you. In this particular class, all I'm trying to say is that this particular three definitions you have to remember. What is hygiene? That is nothing but the condition and practices. Number two is the health, where not merely of the absence of disease, but the physical, mental, social well-being also is necessary. And the sum of all contribution to the physical, mental, and social well-being of humans to an understanding and application of veterinary science. That is nothing but the veterinary public health. And please, you have to write this definition as it is. Okay. For today, this much only. And guys, thank you so much for your patient hearing. Most probably by Friday also, I'll be taking your classes. Okay. And please give your roll number to Mr. Varun Hapa so that he will be giving and he will give me those. Uh, so he will be the person who will be giving me all those attendance, and we are marking your attendance. Today, I found that there were only 53 or 54 students. So please take care of it. Anyway, guys, thank you so much. We'll meet.